Now let's talk about another concept. The conscious mind and the subconscious mind. The conscious mind is like a ping pong ball. Boom, 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 boom. It could be in one place at a time. That's the posture you see when the person stands up. When they sit down, or lay down, now they're in the subconscious pattern. Now, not to confuse you, but there's a big difference. The subconscious records everything from conception. So if you have somebody you know who's young and they get pregnant, the words they say, the music they listen to, the associations that they have is affecting the baby from conception. The baby will respond to whatever mom was going through. So when the baby comes into the world with its own spirit that it got before, now the subconscious mind is partially programmed, then it starts to develop its conscious mind and learns how to do things consciously. Now keep in mind, I've told you before, your body is like a new computer at birth with many programs in it. Some of those programs are designed by God. Most of them are. Some of them are designed by mom and dad. And dad says, you're pregnant, we don't have a baby, so the baby feels unwanted right now. And the dad finally says, well, I guess it's okay if you're pregnant, but you better have a boy. Well, it's already decided. You might have a girl in there. The baby says, oh, crap.
You don't want me.
I got the wrong features. So then my baby born and starts to act like a boy because it wants to please dad. So the brain does a lot of things to survive. Okay, so I'll pass one of these out to you. We're going to review this and just take one and pass it on.
I remember her mom at the hospital had a baby. She wanted a girl so bad and she got a boy. I've never seen anybody act like that in my life. She was furious. And to this day I wondered how that child is.
She affected the child for life.
Absolutely,
for
absolutely.
Sure.
But I keep thinking I chose, you know.
Do you know that in Idaho, the number one cause of death for teenagers between the age of 15 and 22 is suicide, because they're not happy with who they are and what's going on. Thank you. So we'll go through this quickly. The body is an outward expression, outward manifestation of inner conscious and subconscious patterns. That's a true statement. The pelvis, that's the foundation. Male goes left, female goes right. If they're healthy, can the male go right? Yes. Now we have a problem. If we have a husband-wife relationship, they both go right. If you're female, try to stay right of the male. Always keep him on the left. For males, we go left. We will keep her, if a wife comes left with us, starts arguing with us, stay on the left side more. And that shows up on X-ray. The head, that's from the side view, should be balanced over the shoulder and directly over the ankle bone on the side. So when you look at a healthy body, like we took the picture, am I okay? We took the picture of you standing from the side. Your head was over the shoulder, your head was over the bone on the leg, it's called a malleolus, that little hard bone, the knee, the hip, that's neutral posture. We don't want to be too far forward or too far back. Most people go too far forward, which means they act above tissue tolerance. Above tissue tolerance. When I think of that, I often think of my son Andy when he was in high school. He had an old beat up Volkswagen, which was very dangerous to drive. At 60, it was a death trap. So he drove it at 35, which is fine around town, you know. That's all he needs. Didn't have a heater, so he bought a Coleman heater and heated it from the inside with propane. It's not safe either, but it worked. Tissue tolerance, that's a big deal. Now, the thoracic spine and the lumbar curve, just so you know what those are. The thoracic spine is a part of the spine that has ribs attached. 12 vertebrae, 12 ribs. That has a nice smooth curve. The top of the curve should be about 25 degrees. If it goes too high, we have a problem mentally. People whose head goes too far forward are usually self-critical. They start thinking bad things about themselves. They develop what's called, medically it's called a dowager's hump. So it's steep in here, it's always painful. This is always tight because the head, the weight of the head. And every time the head goes forward 1 inch, it gains 10 pounds in effect. So in effect, if your head is 4 inches forward, it weighs 40 pounds. That breaks these bones down here. A patient, a lady I saw today, when she came to me 2 months ago, these vertebrae were breaking out. They were breaking, they were fracturing. When I looked at her X-ray, I thought she might have cancer. They were just crumbling. So we sent her out and got checked. She doesn't. And now today she came in and she's back up here. She's been using the T-zone faithfully. And she's now walking upright. That's this part of the body. When you hold back and do what you want to do, this part of the body breaks down and you start looking like this. If you're not doing what you think you should do, your body will break down like that. Now, when you go down into the low back also should have a nice smooth curve. If you have anger and you hold it in, you develop bowel problems, bladder, prostate, kidney, from holding in anger. It's a big, big problem. The low back needs to have a nice, smooth curve. This is all on the paper that I give you. It affects the personality. A lot of really good people have an opportunity to get angry. And they do, but they suck it in, they hold it in. They don't want to look like they're not a good person. What's her name's always smiling. She's always happy. She never whines, she never complains. But inside she's got a lot of anger stored up that breaks her down. Okay, standing reflects the conscious pattern, I told you that. Sitting, the subconscious pattern, that's an accumulation of history. All patterns can be modified. How? By conscious, repetitive microtherapy. It takes at least 21 days to change the pattern in the subconscious mind. 21 days. So when you're doing the self-care, you say in the words, I'm getting better and better every day in every way. Keep in mind, it's very slow. You're going around the triangle. You're trying to fix the whole triangle so that the triangle looks normal shape. Okay? Any comments or questions about what I said to you? Okay, now, to change the pattern, act as if your things are normal, like you want them to be. Do what healthy people do. Focus on the weak things. Remember, it's always You can always change by changing the conscious pattern. Okay, now we're going to go through the true-false question, and then I'm going to hand out to you a picture of that summarizes everything we talked about. So, Carla, would you read for us?
Mm-hmm. Like a two-edged sword, posture affects personality, and personality affects posture.
True.
Posture modifies tension on the brain tissue, which modifies its function, i.e. behavior.
True.
Head forward posture causes one to behave more aggressively than tissue tolerance.
True.
A flattened lumbar curve is indicative of internalized anger.
True.
The flattening of the thoracic curve usually is a sign of self-abuse.
True. That's when this part of the spine goes flat. Right there. So next time you're at church and you shake hands with somebody, you can do an exam. Just hold their hand and put your hand on the back and kind of see how they're doing. My wife is really good at looking around and she's like,
She needs you.
One leans less to the right when trying to be emotional or right.
true.
Leaning, listening to the left allows for increased logic.
True.
Dowager's hump is more common in females and is related to excessive self-critique.
Why females?
We're very hard on ourselves.
That's exactly right.
We're bad wives, we're bad mothers, we're bad sisters, we're bad friends.
And it's all
When we're not.
it's a figment of their imagination. And they went to homes to be really nice. I had a son-in-law that says, "Man, I could live anywhere." He's a redneck. A good redneck.
Increasing the angle of the sacrum has a tendency to increase creativity, sexuality, and expression.
That's very true. That's the angle of, we're talking now about this part of the body looking through from the side. If I took an x-ray of a person, that's one of the things that I always looked at first. That should be about 45 to 55 degrees, just like that. That starts the lumbar curve. If it's flat, I know that they're probably unhappy, they're not creative. They might even have a death wish. If it goes too low, if it reverses. So the back part of this foundation for the spine, the foundation should be like this. If it's like this, they don't live. That's a true statement. And I've told many people in my practice, when I looked at that, I said, I want you to talk to me about thoughts you've had about ending your life. And every time they've had that thought, and had some of them who have then killed themselves because they did not do what I told them to fix that. For example, one fellow who he had a left pelvic drop, which meant it was 18 millimeters less, which means he did not like men in society. He didn't like any men. I said to him, you must get male friends. You go golfing, go join a club, choir, go to church, get a church, bowling league, something. You need male support because you don't have any male support. You had no family support, no male, didn't have a dad, didn't have brothers, didn't have any kind of support. He went to the medical doctor. The medical doctor said, no, you have a disc problem. You have a bulging disc. That's what's causing your pain. I said, no, the pain's caused from an emotional deficiency. I strongly encourage you to get male friends. About a year later, he still had chronic low back pain. I said, took another x-ray. I said, you haven't fixed the problem. You still have the same issue. You must get male friends to help support you. About 5 months later, he went over to the Garden of the Gods one morning, lay down, shot himself in the head, ended his life because he had a true death wish. I had another lady patient who she didn't like her husband. I could tell that by the way her left hip was. She had a lot of anger. She had a lot of anger about her husband. And they said, I shouldn't have said this, but he did. Came right out of my mouth. Do you want to shoot your husband? And she said, I did. And they didn't kill him. So now, guess what? I'm taking care of him. I shot him right through the spine. He can't walk. He lives in a wheelchair, and I have to care for him. I said, shoot him again. No, I didn't.
She's probably more angry now.
She wanted to, yeah.
She's not in jail.
Right.
She did. It's real. Okay, next.
Decreasing the angle of the sacrum has a tendency to decrease creativity even to the point of a death wish.
True.
It is always best to be balanced.
True.
The greatest position of power is relaxed balance with neutral spinal column.
Totally true. Okay, now this happens to be a summary for you of everything we talked about.
So you're talking about the T6, you're talking about the vibrating machine?
Yes, T-zone.
T-zone?
Yeah. One of the greatest advantages, thank you for bringing that up. One of the greatest advantages of the T-zone is when you stand on it, if the only thing you ever did is just get on it and stand, your body will try to self-adjust to get the weight of the head directly over the center of the body in the pelvis and the feet.
So I've been standing on mine pretty much every day for 10 minutes, and my body is stiff and sore. I
Okay,
can hardly walk.
because you're moving from abnormal toward normal. Now, let me comment on that. And next week I'm going to talk a lot about the T-zone and how to use it. But for your issue right now, you're on it too long at one time. You've
Okay.
exceeded tissue tolerance. You're a typical male. You think more is better. And like I said to you today, she's changing real fast. I said, she's on 2 minutes or 3? 2 minutes. And she's changing too fast. So I told her to use it less total number of times. She's been doing 5 or 6 times a day, but only for 2 minutes. So we cut it today down to 4, maybe 3, to stay within tissue tolerance.
Okay.
So you do less time. Maybe, do you use it twice a day?
Just one.
Once that. Okay, so if you do 10 minutes, if you did 3 times 3, you'd have 9 minutes, less total time, more improvement.
Okay.
Try that.
All right. I was wondering why I'm so sore.
That's why. I had a good friend who owned an exercise company. I had a lot of big fancy stuff. I said, come over, I'll show you the whole body vibration. He got on it and kind of smirked. Oh, this is not doing anything. You know, 'cause he's just a hard cranking. And I showed him one thing, showed him another, showed him another. I couldn't impress him. He tried more, he tried more, he tried more. I said, you've been on there long enough. He said, this is not doing anything. Yes, tomorrow you call me. So he played around for a long time. Tomorrow he called and said, well, I'm sore all over because it went to my son.
Mm.
One night my wife was on the telephone. I think somebody called her and she was talking away and stayed on too long. just sit there and say, so, okay, now let me review with you this handout. Profile review. Conscious is present time, one thing at a time. That's what you see when it's standing. Subconscious is the accumulation over time. And that occurs sitting or lying down. Now that's why when we have a class on posture, I talk to you a lot about sleeping posture. You want to sleep neutral. If you sleep like you're in a chair, knees up, head down, that changes the way your brain works at night. Your brain should heal at night, not be aggressive. That's where you support the head, knees bent, feet back. You keep the spine neutral, whether you're sitting, standing, or lying, not the neutral. Okay, now, just following me down the page a little bit. It says A25-025P. That's the side view of the spine, meaning the head can go forward or back. The 25 is a number meaning millimeters. The reason we use millimeters on X-ray is it's easier to measure than a quarter of an inch. So we'll go by 25 millimeters is about 1 inch, just so you know. You can go, head can go forward or back about that far. Again, what does that have to do with the personality? Aggressive
forward.
or passive? Now go down to the bottom picture with the big ears. Centered is optimal. We're looking at the patient from the back. We see his ears. It says 12, 0, 12. That means the head can go left or right about ½ inch. That's the thing I drew for you here, the normal range of motion. Then go back up to the top. On the right down the left side, it tells you what it means. Aggressive is assertive. The curve in the thoracic spine where the ribs are. I showed you that part. The ribs, the rib part. You see the brain. It says T1 25 degrees. That's the, if you take an X-ray, that's the angle that bone should sit. Yeah, the higher it is, the more you don't like yourself. The lower it is, the more things you should do that you're not doing, you're suppressing. It says it right on the page. So this is a very good summary of the whole thing. At the very bottom, it says another picture, I think. No. If the pelvis goes 5 millimeters, it's self or spouse. 10 is family member. 15 is church. 20 is society. 25 is government, 30 is God. So when I look at an X-ray, of a person, the hip was very, very low. The lower it is, the further out from the center the problem exists. My friend who had killed himself had a pelvic drop way down like that. So what does that have to do with you and I in our life? One of the most important things for each of us is our relationships with people and them with us. If you will think about what you learned today and practice assessing people by their posture, you will be able to relate to them where they are. I give you two stories to make the point. One, I went to a political rally a long time ago. We had a politician there. He was talking to chiropractors. And he said to the group of chiropractors, when you meet a representative from government from any level, don't tell them you're a chiropractor. Because if you do, they pigeonhole you with preconceived idea of a chiropractor. He said that our group, the first thing you need to do is make a relationship with them. Get to know them as a person. And keep it there. And then when they find out what you do, they'll say, oh, you're not that bad. The same is true with, if you want to be a missionary. Hi, I'm a Mormon. And boom, you're in a category. But if you just relate to them and get to know them, and it's you are. I had a couple that I treated, mom and dad and 3 kids for probably 2 or 3 years. And one day they came to a class at Christmas time. And at Christmas time I talked about Christ. And they were totally blown away. The husband came up to me and said, I think you were a Mormon. You sound like a Christian. I said, yeah, I'm both. He had me, in a whole different category because of what he heard. He was totally relieved. It's like, sweet,
Journey.
The other story is, I had a young couple that had a small business. They sold stoves, fireplace stoves, for houses, and the business was slow. One day I said to them after class, I said, if you watch your clients when they come through the door, and you do a quick assessment of the left, if they're left, they want some data on the stove. If they're right, light the stove. Have them feel the heat. If they're forward, just sit and watch them. If you have any questions, I'm over here. If they're back, lean back, can I help you? They go over and kind of help them because they're holding back. Their sales tripled because they were not pushy. They treated people from where they were. They established that relationship, helped them a lot. Okay, any questions yet about this? One of the things I would like to mention down on about just under halfway, it says female and the word scoliosis. Scoliosis is a curvature where the spine, for some reason, goes off to the side. When it goes off to the side, the head always wants to be in the middle, so it curves and comes back. If it went too far, it will curve too far and go to the other side. Then we'll curve again, trying to get back to the middle, so the head's in the middle. It's way more common in female than male. Why? Females want to do everything right, and they are self-judgmental a lot. Most scoliosis problems, not all, most are related to the mental emotional conflict. They don't know whether to be right or be super, so they go back and forth. They don't know whether to please mom or please dad, so they kind of live in their life and not who they really are. when the spine curves this way, it changes the side view. It changes this curve when it curves to the side. But the body will automatically always try to be centered.
So would it be true then that curve and scoliosis follows their male or female problem? Or not necessarily? If they have, it starts to curve right, so they have a problem with
Female.
females.
And sometimes it's south.
Okay.
The female that they're having trouble with is south.
Mhm.
I had a few patients who were very bad curvature. Their problem went left. Why? Because they're trying to be like dad. They want to please dad and be a super kid. But it wasn't them, it was forced. And then they go to the surgeon, and the surgeon puts rods in them to kind of help that. The most important thing is the head wants to be balanced. Even you can have a bad curvature and have the head in the middle, be totally okay, because you're totally compensated. The very sickest ones can have a straight spine that's off to the side with no adaptation. Good question. Thank you very much.
Thank you.
Thank you very much.